Hey everyone, Dr. Shaikh here from The Dentalist, and this is part 2 of our chapter 14 on denture lining materials. In the last video we discovered the basics, but there were a few key details that we didn't include, and I want to make sure you get everything you need to feel confident in this topic, both for clinical use and for exams like AFK, NBDE, and ADAT. So let's start with the full classification of denture lining materials. There's hard reline materials, tissue conditioners, soft lining materials, and then self-administered lining materials. We'll go through each of these now. Let's talk about the hard reline materials first. These are acrylic-based materials used when a denture needs permanent adaptation to the tissues, typically after resorption or long-term use. It is usually heat-cured polymethyl methacrylate. It is used when tissue is healthy, but the denture fit has changed. It is long-lasting, not that strong, can be uncomfortable during healing phase. According to classification, hard reline materials could be of two types. Type 1 is heat-cured acrylic reline materials. It is used in lab process relines, provides high strength and better adaptation. It requires a processing unit, and it is not done chairside. Type 2 is self-cured, cold-cure acrylic reline materials. It can be used chairside, useful in patients who can't be without dentures, less color stable, and it is slightly weaker as well. Now, let's talk about tissue conditioners. These are temporary soft liners used to promote healing of abused tissues before making a new denture or relining a denture. It's made of ethyl methacrylate and plasticizers. It is used for short term, typically 3 to 7 days. It has gel-like consistency that flows under load, promotes mucosal healing, but loses elasticity quickly, so therefore it's not a long-term solution. It is used before taking final impressions when tissues are inflamed. Now let's talk about soft lining materials. Let's break this into 3 key types based on chemistry. The first would be acrylic-based soft liners made from plasticized polymethyl methacrylate. It is flexible but loses softness over time because it leaches plasticizer, and that's why it is often used as a temporary soft liner material. The other type is silicone-based soft liners. It is made of polydimethylsiloxane, which is more stable. It does not lose elasticity easily, and it is hydrophobic, so it doesn't bond well to acrylic unless treated. Used for permanent soft relining in sensitive patients. So these soft liners, especially silicone and acrylic based ones, can be cured in 2 different ways: cold cure, which is called a self-cure, and heat cured as well. Silicone based liners are further classified into 2 types: condensation cured silicone, which would have a byproduct like alcohol. It would have greater shrinkage due to evaporation, and it is more technique sensitive. So the other type is addition cured silicone. It has no byproducts, and it is more dimensionally stable. It has better long-term performance, and it is definitely a preferred option when available. Then there's another type which is called as polyphosphazene-based soft liners. They're rare but important to know. These are advanced polymers with excellent thermal stability, elasticity, and chemical resistance. They're very promising, but not yet widely available commercially, but it is mentioned in the book as a newer class under research. One more aspect that we need to talk about is the self-administered lining materials. These are over-the-counter kits patients use at home to reline their own dentures. These are typically cold cure acrylic or soft polymer. It is often inaccurate and short-lived, and they can mask tissue issues or cause fungal infections. It is mentioned as a patient-driven option, therefore it's not recommended for long-term use. A clinical insight towards that would be, if a patient mentions relining their own denture at home, always check for poor adaptation and underlying mucosal trauma, because that's very common. And then here's a table that would help you understand all the soft liners that we just discussed about. Now let's talk about some exam tips. So if they ask you about which soft liner maintains softness for the longest time, what would be your answer? It's basically silicone-based. And if they ask which soft liner is under research for advanced properties, that would be polyphosphazene, which we just discussed right now. Which denture liner is best for healing inflamed tissues? It is tissue conditioner. Which material is most stable for long-term soft lining? It is silicone-based liner. What is a disadvantage of self-administered liners? It is poor fit and potential for infection. Now, what's the main plasticizer used in tissue conditioners? It is BPBG, butyl ptenyl butyl glycolate. Okay, which type of soft liner has better long-term dimensional stability? It is addition-cured silicone. Okay, here's another one. What is type 2 hard reline material? It is self-cure, also called as cold cure acrylic used chairside. So to summarize everything that we did today, you need to understand that denture lining materials aren't just about comfort. They're essential for function, healing, and long-term success. You now know the full classification, material types, indications, and limitations. That's it for today, my friends. If you found this video helpful, subscribe and turn on the bell icon. And if you want to master dental materials with my help, I offer a 4-week coaching program for serious students. Check out the link below in the description and sign up today. I'll see you in the next one. Take care till we meet again.